Well, it's been, I think, about 2 weeks since I made the last video. Uh, we're just continuing on with uh, all the medical stuff as far as the cancer and uh, the surgery. Last week, last week, I actually got the staples pulled out. My outside staples, the inside staples will never come out. But yesterday, we went and seen Dr. Reddy, which is the doctor that deals with the cancer and that. And I had a bit of a surprise. Instead of like when other family members of mine back in the 90s had cancer, and of course they wound up dying from it, they were actually going and having chemotherapy about 3 times a week. Matter of fact, when my dad had it, actually was taking him to all his appointments. But for mine, where this is where the surprise come in, instead of it being 3 times a week for the next 6 months, I'm told that it's only going to be once every 2 weeks. So it's still going to be for 6 months. It's going to be 12 treatments. I'm going to have to go to Northside Hospital, which I still got to give prompts for Northside Hospital. But I got to go there and sit for 6 hours once every 2 weeks for the treatments. So we're going to see how that's going to play out. I'm not sure how it's going to affect me because everybody that I talk to that has dealt with it tell me that everybody reacts differently to it. Some people, like with my past experience with my family members, they were sicker than a dog the whole entire treatment, but they were getting it every 3 times a week, every week. And one of the people I was talking to just yesterday told me that his wife had chemotherapy. She had it once a week, and she would actually go get her treatment and then drive herself home, go to bed, and then the rest of the days up until the next treatment, she said she was fine and did everything normal. So we're going to have to wait and see how that turns out. Back to the people with the Northside Hospital, they are fantastic. I mean, they actually called the other day, and they're actually sending me what I didn't even know existed, uh, Uber gift cards, just to be able to get back and forth to my appointments. And I didn't even know that was even a thing until they called and told me they were sending that stuff to me. And when we seen Dr. Reddy and dealt with her staff, top notch. I mean, even the lady that we talked to at the end to tell me when I have to come in for their, she called it training. Don't know what that's going to be because that's uh, like not this Friday, but next Friday. I got to go in for that. I'm assuming this is all guesswork. I'm not sure exactly what their training consists of, but I'm guessing I'm going to have to sit down. They're going to tell me all the side effects and what to expect, things like that. But even the lady there made an appointment with radiology for me to have what they call a port put in, to where they actually give the infusion type chemotherapy. And I got a phone call from them today asking me when I want to come in, not telling me when they have availability, but asking me when I would like to come in for that port insertion. I can't say enough good things about Northside Hospital. They bend over backwards more than anybody else in my experience has ever done, especially in the medical field. as you may have noticed in the other videos, I said about me going to the Cab Medical Emory Hospital and to Grady Hospital because of the pain I was in for all those years. And they all kept telling me there was nothing wrong with me. Go home. Go to Northside Hospital, and all of a sudden they actually do testing, find out why I'm in pain, and find out that I've had cancer for the last several years. I had cancer when I went to those other three hospitals that told me, oh, there's nothing wrong with you. Go home. Get out of here. So, Northside Hospital, if you're in Atlanta, I don't know how Peachtree Hospital is. I've never been there, never dealt with them. But if you're in Atlanta and you want to have good, exceptional health care, go to Northside. They're not just going to tell you, get out of here, you're faking it, or anything like that. They're actually there to help, not just throw you out the door and bill your insurance company before you get home. So in case you wind up dead by the time you get home, they're already paid. That's all those other hospitals are interested in. They want the money. They don't care about you. They want their money. They don't care if you live. They don't care if you die. They don't care how much pain you're in. They just want you out the door. And they want the money. That's it. North side, totally opposite. They care about you. They want to help you. They bend over backwards. They have been nothing but angels. Best way I can explain it. I don't know how else to put it. I mean, they are there like they should be. The health system is there to help people, not throw you out the door and bill your insurance company before you hit the sidewalk. The North Side is there to help you. They're there to make you feel better. They're there to support you. They are there to help. So Northside Hospital in Atlanta is where you need to go if you need medical assistance. There's a few things that I did write down here. I said about the gift cards, Dr. Reddy's staff, the port, every 2 weeks in Staples. Now, when I dealt with my relatives, my dad, my grandfather, and that, we had a family basically there supporting us. Here, unfortunately, it's just me and Kaylee. I mean, granted, Northside Hospital's bent over backwards. They are doing everything they physically can do to help. But there's another component to all this stuff. And if any of you out there have ever had cancer or have had to deal with family members that have, you know what I'm talking about. There's an emotional side of this. And here with being Kaylee, I've always been a concrete rock when it comes to emotions. And this is one thing that I'm worried about because I don't let things get to me emotionally. I just let them bounce off me. Well, with what's coming, I don't know how strong I'm still going to be on this. And unfortunately, I can already see it wearing on Kaylee. Kaylee has had her dad that went through cancer twice, but back then she also had her entire family to support her, and they supported each other. Well, unfortunately, since my grandfather died, my family up there in Pennsylvania isn't even worth anything. I mean, they're always at each other's throat. And I knew that was going to happen when my grandfather died. That's why right after he died, I got out of town. And, I mean, that family up there has stolen anything and everything I had. Most of the time, it was for their benefit. Like Alfred and Sharon Peterson. I mean, they went in my yard and took the last thing that I had that me and my dad built and destroyed it, junked it, crushed it, just so Alfred had money to go drinking that night. Things like that. I mean, that's the kind of family that is up there. That's why I don't even consider them family. I don't deal with them. I'll never go back because of that. But back to the original subject about Kaylee. I have to be strong for her because she's already feeling the pressure. And if any yins have had to be support for somebody going through cancer, you know how tough it is on them. Honestly, I think it's tougher on the people that are trying to be there for the patient than it is for the patient. I know some yins are going to say, oh, you don't know what you're talking about. Well, I've been on both sides. I am now the patient, and I've been on the side where I was the support. So I'm sorry, but yeah, I do know what I'm talking about. It was a lot harder for me as the support than it is for me now. But where my problem's going to come in now is I have to be both. I got to be the support for Kaylee, and I got to be the patient. Which is why yesterday when we went to the office to talk about the chemotherapy and that, I was actually on the fence about not taking the treatment. If they would have told me that it was going to be 3 days a week, more than likely I'd have told them, forget it. But they told me twice a week, or once every 2 weeks. And I did ask them about if it got too much, if I could quit. And they told me yes. At any time, I can stop the treatment. So right now, we're going to go ahead and go on with the treatment. And I will have to evaluate as things progress to see where everything stands and whether or not to proceed at that point. The biggest concern that I have is not for me. Kaylee's having a hard time now, and we haven't even started the chemo yet. So it's going to be a lot to deal with. She can't keep taking days off of work to be running me around. So I'm in the process of trying to get the little car that's out in the driveway fixed. I got to fix the front brakes and do as much as I can for driving me back and forth, because these Uber gift cards, I don't know how many's coming. I don't know which treatments I'll be able to use them for, like getting the port put in Monday. I asked when they called about using Uber to do that, and they told me definitely not. That I had to have a driver and somebody that could take me in and out. Well, I had a PICC line put in several years ago because I had an infection, a bad infection, to where I had to give myself an IV twice a day. I don't see where this port thing is going to be any worse, because I believe it's pretty much going to be kind of the same thing. So why I really need a driver, I don't know, but I'm trying to do what they say. But like I said again, I can't keep having Kaylee take days off of work just to run me around. So there's quite a few factors involving her emotional state. We cannot afford her to lose that job that she has, because it's a good job. She works from home, and she makes a enough money to support us, because unfortunately, with what I've been going through, I haven't been able to get out and do anything. So I have nothing coming in. But I mean, that's pretty much all the new information I have at this point. Um, know that everything I've seen on YouTube says about making videos like weekly or bi-weekly, but if I don't have any new information, I don't have anything to put out there. So I don't see any sense in making a video just to sit here and ramble on. But if I have new information like I have now, I figure I'd go ahead and make the video. And something else that we did last Friday, which we have never been to one of these before. A friend of ours, Larry, his wife died while I was in the hospital, so we went to her funeral. And it was the first funeral of color that we actually went to. So there was a lot going on there. I mean, we've never been to a funeral like that before, where preacher was up there jumping around and hollering and preaching, and then other people would get up there and they would preach and sing, and to me it was strange. But I got talking to some other friends, and I guess most uh, funerals of color are that way. But it was something definitely different. Wound up being there for like an hour and a half in church pew, and that was probably more than I should have done, because the day before is when I had the staples removed, and sitting up there all that time caused me some pain. But I felt that we needed to. Yeah, I got a kitty cat coming across here. But Diddle likes to keep pestering me. But in all, she's a good cat. One of Kaylee's 6. Yes, she's got 6 cats here. But I think we're pretty much to the end of the video. I don't have any new information other than what I've given. If there's anything else that develops, or as things develop, I'll make another one and put out there. But that's all I have for right now. So if you're watching the video, go ahead and subscribe. So, and I think, notification bell, they say. If you click on that, the next time I put a video up, I guess it comes up and you can be notified about it. And for a while, I don't know exactly how long. I don't know if we're looking at weeks or months, but this is all the information I have for right now. Once I'm able to get back out and do things, I'm going to try and make some edit videos of doing things. I got some friends that are wanting me to go do this and that, but they also understand that I just had surgery less than 3 weeks ago, so they're not pushing for that. But they, like, one wants me to go and supervise him putting kingpins in his own truck. I don't know if I'm going to be able to do that. I'm not sure when he wants to do that. But we'll wait and see. I mean, if that comes to be, then I'll probably use my phone and try and do a video on that. But wait and see. And any kind of new info I have, I'll go ahead and put it up. Well, you all have a good day and have a better week. Thank you.